Good evening all. I welcome to the live session of the Trumpcard for Success by Dr. Prateek C. Joshi, Assistant Professor of Orthopaedics from BJ Government Medical College and Sassoon General Hospital, Pune. So sir is associated with Medicine from a long back. That is, just when we had 200 subscribers, Dr. Prateek sir was with us. He just gave a great opportunity for us to host his sessions, that to the very basic one, basic history taking, from the basic history taking and examination till nearly of 5 to 6 clinical cases, long case as well as short case, which are very important from the university point of view. The great advantage or a uniqueness of Dr. Prateek Joshi sir is a short and crisp video which covers every single aspect of the session is covered. So you can just view all those 5 topics, which was pure great, excellent one. So that is the reason why we requested him to conduct this Trumpcard for Success series for the present exam going batch of 2016 batch. Yeah. So I welcome Dr. Prateek Joshi sir. He is here with us to give some tips and tricks which the basic necessary one which is required for every university exam goers. So you can just catch every tips which he gives and give a great person of yourself, a great attempt in your university exam and score a very good mark in your future exams. That too after COVID-19, when you are all entering your colleges, you will really feel difficult to cope up with the new environment where you're going to meet the COVID cases also, and also in between the COVID cases, you have to search for the orthopedic examination cases and to examine the patient. So for that, you need to have a clear viewpoint where you should concentrate and where you should not. So for that, we have Dr. Prateek sir here. I welcome you, sir, and I request you to start the session.
Yeah, thank you. So first and foremost, my name is Dr. Prateek Joshi, and I am an assistant professor of orthopedics at BJ Medical College and Sassoon General Hospitals, Pune. So huge greeting and thank you very much to Raghu and the entire team of Medicine for having me here. And this is where I work. This is BJ Medical College in Pune. It's a beautiful campus. I don't know how many BJ students are watching this session right now, but for those who are not from BJMC, you are most welcome to come and visit us anytime, and we'll be more than happy to interact with you. Now, before I start, as Raghu said, I've been around with Medicine for quite some time. And honestly speaking, it has been one of the best things that I had the opportunity to do. And I'd really like to congratulate Raghu and the entire team of Medicine India, because what we are seeing in the form of Medicine, it is a huge channel with almost 6,500 subscribers and a lot of activities going on a daily basis. So this is what people, us or our seniors, had envisioned as the future of medical education. So for example, if I can sit here connected to the internet and I can see my Instagram and I can give a like to a friend of mine who is in, say, US or in UK, then using the same internet technology, there is absolutely no reason why someone sitting somewhere in India across a couple of states should not be able to access good quality medical education, regardless of where they are and what time it is and which they're in. And that is basically making medical education available for all, which is the logo of Medicine. So cheers to Raghu and the entire team, and thank you for giving me this opportunity to talk to you. So without any further ado, let us start off with today's session, which is the Trumpcard for Success, which is basically how to approach orthopedics theory as well as practical in the light of your upcoming exams and in the light of the COVID-19 pandemic. Now, till last year, the scenario was very different, and orthopedics as a subject is something where the subject is a little specialized as compared to say general surgery or general medicine. And apart from that, it has a completely different line of thought. So because a different line of thought, you cannot extrapolate the principles of the other subjects. Say if you have a medicine case taking format, you can extrapolate that to pediatrics, or if you have a general surgery case taking format, it can be extrapolated basically across the length and breadth of general surgery. But orthopedics is not like that, and same goes for theory questions and theory answers. And in the light of COVID-19 pandemic, pretty much everyone's study schedule has taken a toss, and not a lot of people are really well prepared right now, which is the scene for UG as well as PG. And first and foremost, I'd like to assure you guys that there is absolutely nothing wrong with being or feeling underprepared at the moment, because what we are experiencing right now is a pandemic of global proportions, and the kind of impact it has taken is phenomenal. And because of that, not a lot of people have ever been so underprepared for what is going to happen in life as is this generation of UG and PG students. So at the outset, please don't be worried or tensed as to how things are going to play out in the future, because everyone is aware of the situation, and therefore the situation itself will also adapt to the way you are prepared and the way you have the less amount of time that you have. So that being said, basically, you will we will divide this session into two parts. First is how to approach the orthopedic theory examination, and then we'll talk a bit about the orthopedic practical examination. That leaves apart two things. That is, number one is the orthopedic radiology or X-ray, CT, and MRI in case of orthopedics, and the second is instruments in orthopedics. And I think Raghu is going to organize a separate session on that, and I'd be more than happy to take instruments and radiology in two separate sessions. So let us not increase the length of this particular session by going into these two topics right now. So now, as we said, how to approach an orthopedic theory examination. Now, I don't know how many students from Maharashtra and how many students from elsewhere in India are watching this. So the thing that matters is that across the country, as your university changes and as your state changes, the question paper format changes. So the amount of time you have changes, the amount of questions change, and the amount of marks weightage which you are giving to a particular question, that will change. But there is one common principle, friends. There is one common principle which does not change regardless of where you are and what you are studying, and that is time management. And so, keeping in mind that there is a principle of time management, your aim as a student writing an answer paper automatically becomes to put out the maximum possible information in the minimum possible time. So basically, this is your common agenda. That is, as much information as possible should be put out from your side in the minimum possible amount of time. And therefore, common agenda while writing the paper is keywords. Now, what exactly are keywords? Keywords or catchphrases. Basically, they are very specialized scientific terminology which you will find in a standard textbook. They are named syndromes. They are names of conditions, they are units, they are things like that, which are absolute scientific data. And it is important that when you're writing a particular theory answer, you should have as many of these keywords in your answer as possible, because when you are writing the answer, it should not sound like a layperson writing an answer, or say it should not sound as if someone is writing an entry for Wikipedia for normal non-medical public to read. It should sound like a doctor is talking to another doctor about that given condition, and therefore it should be scientific and it should be professional. Now, this is all into semantics and pragmatism. Basically, this is how it should feel. But the question is, why should you focus on that as a final MBBS exam going student? And that is why I bring to you this particular concept, which is called as OSCE. OSCE. OSCE is Objective Structured Choice Response Examination. Okay, so OSCE is basically the next big thing in the field of academic assessment, and the DNB exam, some cases of the MS exam, and vast majority of foreign exams are using OSCE as a means to write the question paper. Now, basically, what is OSCE? OSCE is that you write one particular paper, say one A4 side full of whatever you want to write about a particular topic. The examiner is provided with a set of keywords which he or she has to look for in your answer. So say for a 10-mark question, the examiner will be provided with 20 keywords, and they have to go on checking if you have covered these keywords in your answer. If you have covered those keywords, you are given marks proportional to the number of keywords you have covered. So basically, they want you to cover as many technical and as many scientific concepts in your answer as are expected for an answer for those many marks. And the closer you are to what they expect, the higher you score. So basically, this is the scene behind OSCE. Now, OSCE technically is not used for checking undergraduate question papers. It is not, because it is a system which has to be implemented on a national level, and there have to be standardized question papers and standardized answer papers, and therefore it is not something which is used for undergraduate question papers as of now. But what happens is that, see the scenario where you have 150 to 200 medical students writing a question paper. Now, these are sent to an examiner to be checked, and the person has to sit and check 200 of those exam papers. Each exam paper has two long answer questions and say 10 short answer questions, which means that one examiner will be reading the equivalent of something like 150 or 300 long answer questions and about 2000 short answer questions, and he or she will be marking them. So in a situation like this, the human mind is to jump from one object of attention to another. So the way a particular neuron or a particular nerve, it can carry a stimulus. It can carry a stimulus either along the length of the nerve, or it can go much faster by jumping from node of Ranvier to node of Ranvier. That is called saltatory conduction. So think of this as the saltatory conduction equivalent of a person checking papers. And because of that, in order to go faster and smoother, the human mind over the course of time tries to jump from keyword to keyword. What does this mean for you? For you, this means that if you write an answer properly and highlight the proper keywords and use scientific terminology, you are likely to score better, because the examiner finds what they are looking for, and they find it at prominent places in the answer where it is supposed to be, and therefore they go on checking off tick boxes in their brain saying that this person has mentioned 1, 2, 3, 4, so on and so forth. And therefore, it appears to be a well concise, a well made, and a properly structured answer. And naturally, you will score better marks when you write something like that. The same, as you can see, the last point in this particular slide is keywords, flowcharts, and definitions. So definitions are, for us as say undergraduate or postgraduate students or young faculty like myself, a lot of definitions are something which we have mugged up over the course of time. Now remember, for a senior faculty checking your question paper, your definitions are not something that they have mugged up over time. It is something for them which is basic knowledge, which is absolute basic knowledge, and they know it the way you know your ABCD. And therefore, if it is written properly, if the definition is written properly and verbatim, if the flow charts for a particular process, say for example, for compartment syndrome or for Workman's ischemic contracture or something which involves a process, if you have made a flow chart, now that flow chart is somewhere present in your examiner's subconscious because of their vast amount of knowledge. They may not have that particular flow chart in their brain, but they know what happens and then what happens and then what happens and how that entire process runs. And when they see that you also have put it across in the form of a flowchart, then you come across as someone who has a structured thought process and who has a way of putting forward information to in such a fashion that it looks organized and structured, and you will score better. Now I have some examples for you. Now, this is a photograph from a set of notes which I was studying for my orthopedics PG examination. And as you can see, it is very neatly written. There are 4 or 5 paragraphs which you can see. The font is perfect. It's going to be perfect because it is a typewritten font, and everything is equally spaced and everything is neatly written. But do you feel like reading 400 pages of this? I doubt if there's anyone in the audience right now who feels like reading 400, 500 pages of something like this, let alone read it and check it if it is correct or wrong, and give marks to it. It is just too much effort. Instead, I'll give you another example. This is my own handwritten notes also for PG. And now for those who are watching, please try to quickly read through it and see that while you are reading through it, you may start by reading the title, then you may start by reading the introduction. But as you start reading, automatically your eyes will jump from one keyword to another. So you will jump from super aging society directly to endemic for degenerative orthopedic conditions, directly to the benefit of regenerative medicine, directly to the 4 points which I have mentioned, so on and so forth. And therefore, basically, what is happening is your eyes are jumping from keyword to keyword like saltatory conduction, and that is what you want your examiner to do, because this is an answer which has content, but this is also an answer which has well formed, well structured, and well organized content. And 100% this particular answer is going to score more than someone who has written 20 pages of this. So this is basically how you should go about your theory paper in terms of writing in your theory paper. Now, I don't think that it is wise to get into detail about detailed time management, for the pure reason that we have a very widespread audience. The last I checked, Medicine channel has something like 6,500 viewers across many universities. Formats change and times change, but roughly, for example, in the Maharashtra University format, we have surgery 2, which involves orthopedics, and there you have two long questions and four short answer questions in a 4 out of 6 choice situation. So in that case, basically this particular paper has to be done over the course of 3 hours. So if you have two short answers and four long answers, you can divide the time which you get proportional to the amount of marks which are allotted to it. So this is the rough principle which you can use. And always on a principle, if you have 3 hours to write a particular paper, then calculate as if you have 2.5 hours. Point number one. This is to provide yourself a half an hour buffer in case something goes wrong, in case you run out of ink, in case you get confused, in case you face a writer's block and you cannot remember something which you thought you had studied, things like that. You should not plan for 3 hours. Plan for 2.5 hours, so that even if you spill beyond those 2.5 hours, you are safe. Number two is keep an extra 10 minutes for underlining. As you can see in this particular answer sheet, keep an extra few minutes for underlining your keywords, drawing boxes around diagrams, and using pencil to make your arrows in your flow sheets, and so on and so forth. Basically, just because we are in a professional college, the number one myth to be debunked is that presentation does not matter. That is false. Presentation matters. I would go to the extent of saying that presentation matters more now than it ever did before, because there is such a large amount of information and you cannot possibly put all of it into one answer. And therefore, whatever you're putting into one answer has to be presented properly and has to look as if you are very well structured and very well organized. Okay, so moving on, the topics of importance. Now, topics of importance, again, because of such a widespread audience, I cannot give you an entire list of the kind of topics which are important. But a good way to approach topics of importance is to open your textbook and divide your topics into trauma, infective, inflammatory, neoplastic, and idiopathic, or etc. So these are the basic headings under which you can divide your topics. And the best way to find out topics of importance for your examination, depending on which university you are answering your examination, is to check out the past papers for that particular university and list down the topics which have been asked in the past 10 years. A smart option would also be to put down tally markers for the number of times a particular topic has been repeated in a given examination, and that will not only give you an entire set of topics which has to be read, but also it will help you rank those topics in the order of relative importance, so that when you have a short amount of time, say you have just 1 hour on the morning of your exam, you would like to revise, say, 5 topics out of a list of 30 topics which you have made, you should know which are the 5 topics which are relatively more important or relatively more frequently asked, depending on the paper setting trends in your city or in your state or in your university. So therefore, the best way is to make these 5 headings. You can make a A4 sheet with all these 5 headings and go on putting down topics which have been asked in the past 10 years, and make this A4 sheet and stick it on the wall and keep on revising until there is not a single topic which has been asked in the past 10 years in orthopedics which you have not read or which you cannot write about. Once you are done with those topics, you are pretty much on a clean, smooth highway to clearing your orthopedics theory examination. Orthopedics theory examination is, at least in the state of Maharashtra, it is shared with the surgery paper, and therefore, in my opinion, the students get a bit of a benefit because the surgery and ortho paper are marked separately, but their marks are clubbed, and the final passing is by the addition of both the marks. So if you have the surgery part which is a little difficult, the ortho part can help you tide over, or vice versa, depending on how the paper has been set. In other universities, I'm not sure, maybe orthopedics, if is a paper in your university like pediatrics here in Maharashtra, then it could be a bit of a problem. Even then, going through the past 10 years question papers for topics of importance is a very good idea, and you should basically not skip out on any topic which has been asked in the past 10 years. Now, moving on, the question is, we have done how to write a particular answer. We have done what all to read. The question is what to write in the particular answer, which means that I'm going on saying from the start of the session that create your subheadings, create your proformas, create your keywords, so on and so forth. The question is what all do you write? And this, my friends, is a long answer or a short answer proforma which you should have in your mind while writing a particular long answer. So for those who are watching this, feel free to screenshot this. This is a list which I have made on my own, and this is not copyright material from anywhere. So please feel free to screenshot and share it wherever you want. So this is the sequence, or this is the workflow through which your answer should go. So starting with the introduction, which is a few lines. For example, let's say off the top of my head, let me talk about making a long answer question on osteoarthritis of the knee. So in introduction, I would talk about what is the meaning of osteoarthritis. I would go into meaning of osteo, meaning of arthritis. I would talk about how it is a degenerative and debilitating disorder affecting elderly people, males and females. I would talk about the preponderance of female versus male, and I would talk about just one line about how it is something which disrupts the activities of daily living and which disrupts the convenience and lifestyle of especially Indian patients. Since we are writing an Indian paper, the Indian population has a lot of these tasks which are related to squatting or sitting cross-legged, and that will be a problem in case of osteoarthritis. So always one line about the perspective for the Indian patient. Going on then, etiology, again I would talk about degeneration, how the cartilage is lost, how there is wear and tear, how the wear and tear is the body tries to build up wear and tear, and the speed of degeneration is much faster than the speed of regeneration, so on and so forth. So etiology and pathophysiology together are a gray area. So there are things which are common to etiology and pathophysiology. So if you want, you can club these two headings and you can write etiology and pathophysiology. Then moving on to clinical features, where I would again very strongly recommend that you make a small table under clinical features and make it, first column would be patient profile, which means what kind of patient is going to come to you. So patient profile means the age of the patient, the sex of the patient, the kind of occupation that they are likely to be going, and the kind of things that they are uh, the kind of complaints that they are likely to tell as a layman perspective. The second part in clinical features would be history, where you can talk about the pain and you can talk about the decreased range of motion, so on and so forth. And the third part would be clinical examination findings. So instead of just writing a huge paragraph under clinical features, you can go into patient profile, history, and clinical examination findings. Moving on then, radiological investigations. What you can do is, now if you can see here, radiological investigations and other tests and management. These are again 3 points which basically they are a gray zone with not a watertight compartment between the 3 of them. So you can put all of them together under management, or you can split them together under the 3 different headings. that is entirely your call. So radiological investigations, again, I would suggest dividing into X-ray, CT scan, MRI, and other investigations such as ultrasound, such as arthroscopy, so on and so forth. Not radiological. Arthroscopy would not come under radiological, but X-ray, CT scan, MRI, ultrasound. So depending on the condition. Now, in case of osteoarthritis, the main and the first investigation would be X-ray. Then you can describe the X-ray findings. In CT scan, not much of a role in osteoarthritis, but you can say that if you are suspecting a minimally displaced osteoporotic fracture along with osteoarthritis, something like that, or any other modality, you can say MRI with cartilage scanning to see how much of the cartilage has been denuded. So you can put it down again as a set of points. Moving on, other tests, if there are. Now osteoarthritis, since we are talking about it, not a lot of other tests are existing. Going on to management, and always this is something which examiners would look for when you're reading, when they're reading your answer, is that don't jump to the most invasive and the most fancy technique of management. Whenever someone is asked what is the management of osteoarthritis knee, the first thing people talk about is total knee replacement. Now, you are not wrong. Total knee replacement is a management option for osteoarthritis, but there are a set of other options which are there. These are given in the undergraduate textbook, starting very basically from your conservative management using local fomentation, using exercise, using drug therapy, painkillers, chondroprotective drugs, so on and so forth. Then there are a set of arthroscopic procedures such as arthroscopic debridement. Then there is your partial knee replacement, total knee replacement, so on and so forth. So the point is that in your management also, you can add a line saying that management is being described proceeding from the least invasive to the most invasive, and then list down the you know, and always add two lines, one about outcomes, which means how does the patient respond to management, which means that how many of these should be treated conservatively and how many of these should be treated invasively. This is all given in your textbook. And the last is conclusion. This may or may not be there, and if you have the time and if you know some recent advance about it, put it down. Otherwise, this is one of the non-essential parts of the answer, that is a conclusion including recent advance. Even if you stop the answer at outcome, it is absolutely fine. So these are the headings which should come in a long answer. Now, if you have a short answer question, generally the short answer question itself will specify what they want. For example, a long answer question may come on osteoarthritis, but a short answer question may say clinical features of osteoarthritis or clinical features or investigations of osteoarthritis, in which case just write the introduction and then go directly to what the question has asked. So I think this is nearing the end of the theory examination. And Raghu, how are we doing so far? Is everything audible, visible? Is there any problem?
Yes, sir. Everything is audible and visible.
Perfect.
So far, everything is good, sir.
Okay, so I think we can move on to the practical part of it. So moving on to approach to orthopedic cases. Now, approach to an orthopedic case is basically another topic in itself, and there is a complete video series on orthopedic case taking, case history and examination on this very channel, which is Medicine INC. So I'd encourage you to go and see that. And I think if anyone requires the link to this, Raghu can provide you with the link for the case history and examination pro forma. Now, just in case there's anyone here who's watching, who is exam going right now, and there is who's looking for a quick pro forma for differential diagnosis at the end of the case. This is what I'm putting here. So you put in the age or sex of the patient, followed by the first line of chief complaints, followed by any significant positive points in the examination, and then you narrow down to the bone. For example, a 75-year-old male complaining of progressive pain in both knee joints, right more than left, and the which was insidious in onset and gradual in progression, with having a decreased range of motion, some amount of joint diffusion, and tenderness on the medial joint line on examination, and therefore my differential diagnosis at the end of the case is osteoarthritis of the knee joint, right more than left. So this is the kind of differential diagnosis. Now, as we said, this particular video on case history examination proforma in orthopedics is there on the Medicine channel, and I think we can go on because most of what we are going to discuss here is discussed in that video. Now, something which I guess a lot of undergraduate students are looking for is the common cases at an undergraduate level, and these are now, this of course depends on your institute and the kind of patients which the institute can bring for your undergraduate examination. But as an undergraduate student, what all are you supposed to know, or what all should you successfully be able to examine as an orthopedic case? And here on your screen is the list. So again, feel free to screenshot it. This is non-copyrighted open source content. So go ahead and screenshot it. And basically, old malunited fractures, non-union, infected or otherwise, chronic osteomyelitis, CTEV, osteoarthritis, avascular necrosis of hip joint. You may have a couple of post-operative patients like neuro and external fixator. And in a rare case, depending on your institute, you may have a case related to spine. Though you can rest assured that at an undergraduate level, complicated spine cases will generally not be kept. You would generally have a one of the simpler spine cases, and even in a spine case, neurological examination, and most of it will be a part about talking about the level of the lesion in the spine. Not a lot of people are going to ask you about treatment options for spinal conditions and endoscopy of spine and so on and so forth. That is strictly postgraduate and above level, and not a lot of this percolates into undergraduate level. But apart from spine, the first 9 or 10 topics which are there are something which you must know. And I think we have covered some of them. Between now, at the bottom of the screen, you can see Rapid Revision of Orthopedics by Dr. Prateek Joshi, which is another channel, which is my own channel, which I'm running. And here in the corner, you see Medicine. Between Medicine and my own channel, we have covered quite a lot of these topics. Those which we have not covered, we will be covering in the due course of time. And so please subscribe to both the channels, Medicine as well as Rapid Revision of Orthopedics by Dr. Prateek Joshi. So
in between, I just have one thing to be asked to you. So you have been discussing about the clinical cases, right? So previously we were very free. We were just going directly to the patient and we were just asking their name, age, so and so. But now if you see after this COVID, there is a lot of chance that even we can't even approach our patient. In that case, what do you think? How we supposed to train ourselves? Because when we are in a position not able to see a real case scenarios where we are not able to just go and take history taking examination and so how do you think the future examination perspective, even if it is going to be in the next month or the month ahead, how do they keep cases and how suppose we should train ourselves to attend those cases? What is your idea on that?
Yeah, that's a very, very pertinent question, and this is something which we are seeing as Raghu said. It is something we are seeing as a result of Corona pandemic, that interaction, one-on-one interaction, as it used to be in the bedside clinics before the Corona era, has become a rarity. And also examining the patient in the Corona time is also very difficult, let alone the fact that a lot of cold or non-emergency or non-operative patients are not approaching large tertiary care center hospitals at all because of the fear of catching the virus, which is absolutely, I would not say it is wrong from their point of view, but that being said, it puts MBBS students and trainee doctors at a disadvantage because it reduces the number of patients you get to see in your training phase. So now, two things is that how to approach a patient like that in your final MBBS examination. Now, in all likelihood, majority institutes are, it is possible that they will go ahead with some kind of a video conferencing or a video platform um, fashion in order to conduct these examinations. So it may happen that the way we are conversing right now, some sort of a clinical examination video or the Viva part of it may be conducted. Now the part remaining about the approaching the patients. Now, approaching the patients in the ward round has become nearly difficult, nearly impossible. But what can be done is that, especially from orthopedic point of view, joint examination and limb examination, at least physiological joint and limb examination at the undergraduate level can be done using a healthy volunteer, the way we used to do in first MBBS for the clinical signs and symptoms and so on and so forth. And therefore, because of that, it is something which you can do at home or in the hostel when you are living. Now, as for the specific signs for a particular case, the it depends, and the examination pro forma is likely to be changed, such as in case of gynecology, when you have the case sheets which give you a history and they give you a set of clinical examination findings, that this was the history of the patient, and these are the findings which you have got, and this is the sheet which is handed over to you, and the viva proceeds from there. So it is likely that the examination will be conducted on uh, those lines, even in other subjects such as surgery and orthopedics. If if there is a clinical examination part kept in your orthopedic viva, you can rest assured that if there is a healthy volunteer, that person will be tested by your institute, and he or she will be a corona negative and a healthy volunteer. So in that part, in that part you need not really worry about corona. But that being said, we are just have to wait and watch as to what exactly the exam pattern would be. I believe it is being finalized by the exam conducting bodies, but with so many exam conducting bodies and so many universities, we have to wait and watch to see how is the final pro forma. And if need be, if once the final pro forma is announced and there is some clarity on that, we can have a separate session on how to handle the changed examination pro forma. However, one thing will not change, and that is a well structured history and a well structured set of examination findings, and the knowledge of the keywords and knowledge of the definitions. So these are the things which will not change regardless of whether there is a live physical patient in front of you or the patient is in the form of a case sheet. These are things which you should know. And so while the examination pro forma is still a matter of debate, these things are something which you can practice for the time being. And the rest of the pro forma, I guess we'll just have to wait and see when it is announced.
Yes, sir. Thank you so much. And finally, I also wanted to ask you a question which everyone supposed to supposedly have with them have in their mind. So, as an undergraduate student, when you were there, how you feel at the time or a day before examination, as both theory as well as when you're standing outside the Viva room, how your mind will be and how suppose we prepare for that? Because a day before the university exams, we will be having a confused mind which one we read and which one we didn't read. Like that, we have confusion. So,
Right.
what is your advice on that?
Okay, so let's do this in two parts. Number one is day before the theory examination, and number two is day before the practical examination. Now, day before the theory examination is always it's a day of performance anxiety. So, 50% of you is basically is apprehensive as to what will happen if I have studied so much, like in what will happen if none of this is asked in the exam and something entirely different is asked. So if you have studied everything and you will, about half of your mind thinks that what if they ask questions on endoscopy of spine and different types of total knee replacements and postgraduate or super PG level questions. And so half of your mind is running on that anxiety. The other half of your mind is slightly hopeful that what if everything that I have studied is asked, and you have this little Warfreud moment thinking that you are writing and everything you have studied is being asked and you are getting a distinction. So your mind is 50% this way, 50% that way. And what worked for me before theory examinations, even for that matter, before my PG examinations and before my post PG DNB examinations, is that you have to assure yourself that the paper will not be any extreme. It will not be extremely good, nor it will be extremely bad, because the paper is not designed for someone who is a genius, nor is it designed for someone who doesn't know anything. It is designed for It is designed for the vast majority of students, myself included, who are somewhere in the middle, who are good at some topics, who are okay at some topics, and who don't know some topics. And therefore, the question paper will be a mixed bag. And secondly, something which I used to tell myself is that regardless of how much you want that you will come out of the examination hall like an absolute film star, having written everything perfectly, it's not going to happen. And therefore, a wise moment or a wise thing to do is to not expect that you're going to write 100%. You should be ready for the fact that there will be a question or two which you are not sure of, or a question or two which you have not heard about, and that has nothing to do with your level of preparation. It is because medical science is vast and medical science is ever advancing, and therefore there is always something new and there is always something you have not read. And even the best prepared people will also have a problem with a question or two, and that is perfectly natural. That being said, if you have a basic idea of most of the questions which have been asked over the past 5 to 10 years, you should not have a problem. So if this is something, a good idea would be to basically write down these things when you are not tensed or when you are not worried about the outcome of the exam, and keep that paper aside and read it on the day before your exam. And you will see the difference in mindset, that this is how your mind works when you don't have stress versus this is how your mind works when you are stressed. And then you will realize that your mind which is working when you are not stressed makes so much more sense than your mind the way it works when you are under stress. And because of that, please remember that once you're thoroughly prepared, 10 years papers, you have done your topics, you know your things, you know what you're going to write and how you're going to write it, no theory paper can directly fail you. Okay, so it is a perfectly achievable target, and it is something which you can very well do. Anyone and everyone can very well do. So it is not a problem. That being said, now the second part of the question is how do you feel outside the practical hall? Now, this is something entirely different, and this is a kind of stress that nobody has ever been able to control. If somebody finds the cure for pre-practical or pre-viva stress, the Nobel Prize of that year will go to that person purely by public demand. So it is something that not a lot of people have managed to master, and actually having a certain amount of stress before the practical exam is not a bad thing. It just proves that you have an idea of the kind of challenge you're facing and you're taking it sufficiently seriously, and there's nothing wrong with that. That being said, the few things which worked in my favor firstly was that don't ask the person who comes out of the exam hall or the a person who comes out of the viva hall ki kya pucha, what did they ask you, how did the viva go, because no one is going to come out and tell you that I had a brilliant viva and I answered everything. Everyone is going to say that it was difficult, I didn't know anything, and they asked me the toughest of the toughest questions, and I'm going to fail. That is what vast majority of people are going to tell you, because that is how the mind reacts immediately at the end of a stressful situation. So that will only add to your stress. The best way would be to just do your thing, revise your own material, and not talk to the people who are coming out of the exam hall until you also are out of the exam hall. That being said, in case of Viva, now in case of Viva or practical examination, a few things which are really important. Firstly, is that the importance of dressing properly cannot be overstated. It is very, very important to have a haircut a couple of days before the Viva. For guys, be clean shaven, take a bath. And for guys and girls, dress properly, fresh, clean clothes, depending on the dress code in your institute, a clean white apron, and your number plate, which is preferably printed, if not printed, at least very neatly written, so that the examiner does not start by squinting and looking at your number, your roll number. Second is that as much as possible, try to muster as much confidence as you can in terms of your body language, in terms of your walking style while you walk into the examination. Remember, you are judged from the moment you walk in and sit on the chair till the moment you give your last answer. And although this is a little tongue in cheek, but the person who walks in like a person who is there to claim the marks that are rightfully theirs is more likely to pass than a person who walks in like someone who just wants to make a punishment quick and easy. So try to walk in as confidently as the situation allows you without making a clown of yourself, and wish the examiners ask permission to sit down and the viva will start on its own. Third is that the talking to your colleagues or the people who have given the viva a day before yours, or for that matter people who have given the viva a year before yours. Remember that whatever you get is a slightly exaggerated account, and no person's viva will ever directly start from super PG questions. Majority 99.99% of vivas will start from a basic question, and the level of difficulty goes up and up and up as you successfully answer questions. Third is that examiners are not psychopaths. They are not there to torture you, and therefore if you don't remember an answer, you can just say I'm sorry sir, or if you don't know for that matter, I'm sorry sir or I'm sorry ma'am, I am unable to recollect this answer, please could you ask me something else. It is much better than just sitting and staring at the examiner and the examiner is wondering if you have blanked out or if you don't know. And most importantly is that when you're examining, now if you have a healthy volunteer for examining the patient, please don't forget to exchange pleasantries. Talk to the patient in the vernacular language, depending on your institute and the language of the patient. And please don't forget to take the consent of the patient before you examine. So don't just jump and palpate the hip of some random patient lying there. Explain to them that you will be examining. Ask them if it's okay if you take down the patient's pants slightly and examine the patient's hip, so on and so forth. So this is on a very basic scale of how to approach a Viva examination. So I think that's something which I can give off the top of my head. Any other questions, Raghu?
Yes, thank you so much. And this is a question which I want to ask you even when I started to just ask you this session, because every student has this type of confusions before the exam night, day before the exam, right? So thank you so much, sir. And how to side by side we have to start preparing for the next, because next or NEET PG or any set any exams, how should we start preparing ourselves side by side with the theory topics? So what is your stand on that, sir?
In terms of preparing for now, this thing called next. Now, next is a fair enigma amongst pretty much everyone. Not a lot of people have clarity about what next is all about. But that being said, now even in your orthopedics theory paper, you will have some amount of MCQs, and the best place to read MCQs is one standard MCQ book. So you can pick up any MCQ book. Most of the MCQ books have similar amount of questions and similar amount of behind it. Now, that being said, a good idea to start MCQs from orthopedic point of view at a UG level is that once you have that MCQ book, you can start by solving these MCQs and reading the theory behind it. And every time you read the theory behind it, just highlight something which is new to you or which you did not know. So the next time when you read that book, start by reading the highlighted theory, because that was something which you have not revised, so on and so forth. Now if say there are through the course of the book there are, or through the course of one chapter you find 20 points which you had absolutely not heard of before, highlight them while you're reading. The next time you read that chapter, you will realize that some points have become familiar because you read them last time and somewhere they are stuck in your subconscious. So it's no longer something that you don't know, and now those 20 points have become 15. So now put a tick mark in front of those 15 points, which even at the second reading have become difficult for you. Now, that being said, um, as and when you go on as and when you go on reading, the number of these ticked points will become less and less until the entire subject is familiar to you, and so on and so forth. So at a undergraduate level, I think this is a good way to handle MCQs.
Thank you, sir. And now again, a question similar to the one which I asked for previously. Now we have very less number of time. We don't know when our university exams are going to be. So on the whole, like we have 4 main subjects in our final years. On the whole, how much time should we allot? Say we are going to start from now on revising our whole final year topics. How much time should we allot for exactly for orthopedics, and should we start our revision?
In terms of revision or in terms of preparation, I think the smartest way to go about, now we don't have a unified format for exams all over the country. Different universities are giving different kinds of papers and different weightage. So I think the best way would be to divide the amount of time you spend proportional to the weightage which is given in terms of marks. So in that case, if you have you have general medicine, the way you would divide, say in case of general medicine, there is cardiovascular system, there's respiratory system, so on and so forth, and you have a rough idea of what is the weightage given to each system. So a harmless way to go about things would be to extrapolate that to the subject and see how many marks orthopedics has, how many marks surgery has, and how many marks say ENT has, so on and so forth, and divide your time in the same unit using unitary method. That's, I think, the best way to go about things, so that you don't disproportionately allot time to any subject, more or less. Just like allotting less time is dangerous, allotting more time than is necessary is also dangerous, because you're taking that time away from another subject. So just make it proportional to the marks weightage according to your university. That would be the best way to go about things.
Yes, thank you. And then there's a common doubt in orthopedics which people mentioned it through their form as well as through the comments. So what is the difference between a Malaysia and porosis?
I think we can take that as a separate topic, because vitamin D metabolism, I think we'll do depending on the etiologies and things. Malaysia and porosis are entirely different based on the etiology and everything else. So, but that being said, they are closely related to calcium and vitamin D and the collagen metabolism. So I think we can do the underlying biochemistry part in one session. It would be better to do that than to bring that into this session.
Yes, sir. Even even Viva instruments, as well as the radiology part in orthopedics, all these are commonly asked questions by the students, and I think we can have a separate session through YouTube.
Definitely.
And finally, there is. We have covered almost every aspect in the orthopedics. What are the important points? How we are supposed to approach the university exam? And almost we had like 150 people who have viewed so far, and it is good. The session went very well. And I guess in future we can have similar sessions, and we can cover almost what are the important topics in orthopedics before the exam comes. And I thank you once again, sir, because you are traveling with us from the very basic. Some very basic point when we started this channel. You are the first one who have accepted the offer, and you have just started to give the videos without even expecting anything from us. And I think we were also able to provide you with a good number of viewers in every video. And it will be good if we have more number of sessions conducted by you in our channel in future also.
Definitely.
Almost
now that I'm back in action, we shall definitely do more videos.
Yes, sir. We have almost like 3 to 4 states linked together and conducting the session. And in future, the viewers, we are also planning for integrated sessions with anatomy and orthopedics by Dr. Prateek Joshi, sir, where we will be covering sessions for the next oriented. For even for the first years, it will be useful where we are going to cover in the next orientations. So I want to get great sessions again from Dr. Prateek, sir. Thank you once again, sir, and thank you viewers also.
Thank you so much. Yes.
Thank you so much, sir.